In this video, we're going to talk about the most popular myths regarding physical therapy. Do you believe these myths?
The first one that we can think of is that PT is either only exercise or only manual interventions. A lot of times people will assume that they're going to come in, just lay on the treatment table, and we're going to do a massage and just work on them the whole time, and then maybe do like a stretch or two and that's it. But often that is not the case. Most of the time that's not the case. Usually there's going to be a combination of both manual and exercise, and as the plan of care progresses, then it gets more towards that exercise phase, because ultimately you're a lot more independent at that phase, and we want to make sure that you're as independent as possible at the time of discharge, since we won't be there to work on you and give you massage anymore. So we want you to be as independent towards the end. That's why it looks a little bit more like exercise only at that stage.
I think number two, and we get this a lot, is that if your pain is getting higher, it means you're getting worse. Obviously, overall, we want to decrease your pain. But sometimes we're gonna have to work into uncomfortable ranges of motion, things that are a little bit uncomfortable to get you stronger and to get you more comfortable in those ranges of motion. Obviously, every visit, we don't want you walking out of here feeling terrible, but sometimes during your visit, you're gonna get a little uncomfortable, and then we're gonna make sure and prescribe rest for you to let that kind of come back down before we let you leave, or give you things that are gonna work to decrease that pain. But sometimes there is a little bit of increase in pain, and that does not mean that you're getting worse. It means that we're working through some of those ranges, and sometimes you have to get uncomfortable to get comfortable.
That's right. And honestly, I think the good thing about PT is that we're able to let you know what pains are okay to feel and what pains aren't okay to feel, because I think a lot of times people don't realize what just true muscle pain feels like. Sometimes just from working really hard and having delayed onset muscle soreness, they're thinking that's pain, but really it's a different type of sensation than true pain that is related to more like tissue injury, things like that. Delayed onset muscle soreness is actually a normal phenomenon that you should feel after working your body pretty vigorously to the point of tissue change for the better. So we can kind of help differentiate that for you, especially if you don't really have a history of exercising in the past, because it's a very new sensation and it can be scary sometimes, but we want to make sure you guys feel comfortable with it. Now, another one I would say would be that PT is always a linear progression as far as your improvement in symptoms. So like we mentioned with the pain, there's going to be days where you feel a little bit more discomfort during a session, or maybe you've been doing really well for 3 weeks, and then maybe you have to go walk around and do a lot of house chores, or you're going to an event and you flare symptoms up. And now we maybe have to just regress a little bit as far as what we're doing in here. And that's okay. It doesn't mean that you're going backwards. It just means that we're taking a little break in the progression, and then we're gonna get right back to it. So a lot of times your plan will look more like a roller coaster, that we like to call it. It's gonna go up, it's gonna go down, but it's still gonna be on that trajectory upward to improvement. So it's not always better each single day. It's gonna have ups and downs, but overall you will for sure feel much better by the end of the plan of care.
And I think going hand in hand with what Larissa was talking about, I think some people think that they go to PT and they do what they do at PT and nothing else, they're gonna get better. And I know people don't like the idea of homework, but not being able to spend more time with you is obviously a limitation of PT. If we could see you every day for hours on end, we would, but we unfortunately can't. So we give you those home exercises to carry over that progress between visits. And if you're only working 2 hours a week, one, you're not meeting those functional goals that we end up wanting you to get back to, that 150 minutes of exercise a week. We want you to be able to do that no matter what age, no matter what stage of life you're at. But we also want you to feel comfortable exercising, because ultimately I want you to be able to manage this at home and manage this independently if you were to flare up. And so those exercises, even though they sometimes feel like homework and kind of seem hard to do or easily to forget about, they're really important to maintaining that progress towards that goal and hopefully making your experience a little bit more linear, because sometimes there's gaps. Things come up, you can't make it into the clinic. then you can supplement those exercises in and still continue to progress without having seen us maybe after you miss a visit. So I think it's super important to make sure that you're really doing those homework exercises and taking those serious, because those are things that you're probably gonna do or want to do for a really long time.
For sure, for sure. And then I think we're on number 5 now. So number 5 misconception I would say is that PT is only for once you get injured. So a lot of times people roll their ankle and they're like, oh, I need to go get treatment. But sometimes you may need to go to PT if there wasn't a specific injury. It could be, like we mentioned before, you're planning to have a surgery and you want to do preoperative therapy. That's definitely an option. Or maybe you just feel like, I'm having a lot more weakness lately, or I don't feel like, I'm able to mow the lawn like I used to. I'm getting more short of breath, those types of things. Those are things we can definitely help with as well. So it doesn't have to just be an injury. It can be a lot of other deficits that you're noticing. Anything that just makes you feel a little off or just not your normal self. Definitely come in for an evaluation from a PT, because they can help determine what needs to be done, whether you do need more testing or imaging or seeing a cardiologist, or if it's something that we can just handle here and kind of make it a one-stop shop. So definitely not just for injuries.
Yeah, and I think Larissa makes a great point, and my number 6 kind of goes hand in hand with that. If people think only have to have PT after surgery, or I have an orthopedic problem, therefore I need PT, but we also treat other things that aren't so orthopedic. You're having dizziness, you're having unsteadiness, you're feeling not balanced. Those are things we want to get ahead of. Those are things that we want to make sure that you're not falling, or that you're not every time you sit up having dizziness and feeling like you're gonna fall, and then you're limiting yourself from doing activities because you're scared of things. Those are things that we want to help you with, and those are things that we want to get better so you can get back out doing the things that you love. And we want to prevent some of those injuries as well. And I think that's really important, and getting people back to doing what they're doing and not spending months, sometimes even years, not doing things because they're afraid of what could happen to them.
For sure. I'm just thinking of a patient I have right now who suffers from severe headaches that we're working with, actually. So that's something that you can't really see. It doesn't seem like something you'd be able to treat with PT, but we're actually seeing a lot of improvement just because she was scared to exercise. She didn't know what to do because she was scared that her headaches would get worse. So we're just educating her on what is actually good for her to do without flaring up the symptoms. And she's finding that the exercise is actually helping a lot just because she's finding the right things to do. And similarly, things like concussion management as well is something that we can work with. A lot of people don't even realize they've had a concussion. So if you had a fall of any sort, or even a car accident or something, or even if it was just a fender bender, sometimes just that impact, it doesn't have to be you actually hitting your head. It can just be from the jolting that you actually do have some mild concussion symptoms. So we always recommend, if you're feeling anything like blurred vision, just even loss of concentration, or difficulty reading, things like that, it's great to see someone, especially a physical therapist, because we can help you just kind of figure out tools to make that progression go a lot faster than you dealing with those symptoms and not knowing why you're feeling it.